Today, we are dealing with a very important objective entitled Approach to Drowning. Okay. So, yeah, I'm going to share my screen. Now, I always say this, and for me, I will say this till, the very end. The Medical Council of Canada exam is an exam which focuses on objectives. So, you know what? I don't really mind the kind of book you are reading or what material you are using to study. The main thing you have to make sure is that you are using the objectives to study. Okay, so let's start with this. We start with the rationale. Why are we dealing with drowning? Why did we choose drowning? Because it is in the objectives. So now, the rationale is this: drowning is defined as the process of experiencing a respiratory impairment resulting from being in or submerged in liquid. Okay, so that is the rationale that the Medical Council wants you to know. Now, the term drowning includes both death and non-fatal submersion injury. So when we use the expression drowning, it's not only talking about, the fact that the person died. No, it could also be that, the person was submerged, but the person did not die. And drowning is a common cause of death, especially in children younger than 10 years. Men and members of some racial or ethnic groups are at increased risk. Look at the way the rationale is talking about specific things. It looks like it's talking about risk factors for drowning. It's talking about ethnicity. It's talking about age. It's talking about gender. So when you are learning this particular objective, these are the things which should be popping into your mind. Okay, they're talking about age, they're talking about gender, they're talking about ethnicity. What is it that I should know about? And then they go on to talk about causal conditions. So this is all in the MCC objectives. Okay, so if you download objective, you're going to see all these things. So some of the causal conditions are inability to swim effectively, missing or inadequate fencing of pools and bodies of water, okay, improper or absent use of approved personal floating devices, then risk-taking behavior and alcohol and substance use, okay, and then use of prescription medication, those that cause drowsiness. So like things like benzodiazepines, things like opioids, you know, all these are medications which can cause drowsiness. And inadequate supervision, especially in the case of children, and patients with acute medical issues as well. And then occupational and recreational water related activities. So these are the causal conditions according to the Medical Council of Canada. So that's why I always put the reference down there so that you see it. All right. Now, before we dive in, they are again going to what you call the key objective. And the key objective, they state something like that. Given a patient with a history of recent submersion, the candidate will make the appropriate diagnosis of submersion injury, assess the severity and complications, and initiate an appropriate management plan and provide education about preventive strategies. So look at the various things here. Number one, you've got to learn how to assess the severity. Number two, you've got to know the complications. Number three, you've got to know how to initiate appropriate management plan. Number four, you've got to provide education about what are the things to do to prevent drowning. Okay, so now we're going into the first enabling objective. So, after you learn about the rationale, the causal conditions, the key objective, now the enabling objective is if you want to build a study plan. This is where you start building, your study plan for. Okay, so it says that given circumstances where there is risk of drowning or submersion injury, the candidate will recommend effective risk reduction measures. Risk reduction measures. So I have one question here. I have one question. And before we get into the question, what I want you to do is this. Please write this down. Write this particular thing down. Non-fatal drowning events occur much more frequently than deaths. So remember that when we started, we said that when we use the term drowning, we are talking about both effects of death from drowning and then those who do not experience any death from drowning. So the first point I want you to keep in mind is that non-fatal drowning events, the ones which don't cause death, occur much more frequently than deaths. So there are more deaths than those who have, there are less deaths from those who are submerged in water than those who die because they are submerged in water. So now let's get to it. Again, drowning quickly causes two things. Number one, respiratory arrest from hypoxemia. Okay, respiratory arrest from hypoxemia and cardiac arrest from hypoxemia as well. So the reason why patients get respiratory arrest and cardiac arrest is because of the decreased level of oxygen. So when we say hypoxemia, we're basically talking about, the decreased level of oxygen in the in the in the in the blood. Okay, hypoxemia is decreased level of oxygen in the blood, basically. So people die from respiratory arrest, and then they also die from cardiac arrest as well. So now let's jump in. Survivors of drowning can also sustain various injuries. And one of the injuries they can sustain can be pulmonary injuries, that is lung injuries. They can also have neurologic injuries, that is to the neurological system. They can also have cardiovascular injuries, and they can have other injuries. So when you are learning, you have to ask yourself, what are some of the injuries which can occur to the lung as a result of drowning? What are some of the injuries which can occur to the nervous system as a result of drowning? What are some of the injuries which can occur to the cardiovascular system as a result of drowning? And now let's use this to learn one thing. From the objective, you have to know some of the risk reduction strategies for drowning. So don't go into the exam without knowing some of the risk reduction strategies because the objective says so. So I want somebody to volunteer and read this question for me. One person to volunteer and read this question for me, please.
You are posted to a new community. What measures can be introduced to reduce the risk of drowning accidents?
Okay, so Dr. Chimas, thank you very much. And you realize that I always tell candidates that, in the Canadian exam, it's stated as, approach to this, approach to that. In drowning, there is, the emergency medicine component, obviously. But then look at this particular question I've put out. It looks like a public health related issue. You are posted to a new community. What measures can be introduced to reduce the risk of drowning accidents? So, assuming you are a doctor in a new community, anywhere in Canada, what measures can you put in place to reduce the risk of drowning activities? Please don't say the answer, just type your answer in the comment section. Education of the people. Well, what kind of education? Fencing the pools, beautiful. And water bodies, that's beautiful. Fencing the water bodies, education, policies to safeguard at-risk individuals. Okay, let's go on. Floating devices, showing people swimming, um, fencing pools and water bodies, accompanying and teaching the children. Sure. So please, if you also have some answers, please drop them because people are really bringing very, very interesting answers. So always remember that drowning is preventable. That's the first thing I want to say. Always, always, always remember that drowning is preventable. And drowning does not only occur in large water bodies. So that's also something you need to really pay attention to. When we talk about drowning, we are not talking about the person who went into the sea and drowned or the person who went into the river and drowned alone. You realize that there are other things we talk about. So, what are the things we can do to prevent drowning? As a doctor, if you are supposed to educate the community, what are some of the things you can introduce such that drowning will be reduced? Number one, you've got to introduce four-sided fencing and gating of swimming pools. Four-sided fencing and gating of swimming pools. Okay, that's number one. Number two, especially in children, you want to emphasize on adequate adult supervision. Adequate adult supervision. Number three, if somebody wants to go swimming, you want to encourage swimming with a partner, just so that if something happens, somebody is there to help. Number four, use of personal floating devices. Use of personal floating devices. Doctors, please, are you following me? Use of personal floating devices. Okay. Then avoidance of alcohol and illicit drugs while swimming or boating. So the patient, you want to encourage them to avoid alcohol while they go swimming, because that can be very detrimental. And then strict supervision of toddlers when they are to bath. So that's very important, because, as I said, when we talk about drowning, we are not just talking about um, drowning as it occurs in water bodies. It could even occur in the home. Okay, so drowning can occur in shallow areas, including bathtubs, even in toilets and buckets of water, if not adequately supervised. And we are talking about, supervising the child in an arm's length way. You want to really keep an eye on the child whenever the child is close to water, because if that child is not protected, danger can happen. So, doctors, please, I want to proceed. I want to know whether you're okay with this. This is the first thing, because this is the first objective which appears. Even before you go into the history and the rest, this is the first thing the medical council wants you to know. What are the things you can do to prevent drowning in the community? So we've learned about what to do about drowning. So always remember that drowning is preventable. I've said it already. Drowning can occur in shallow areas, including bathtubs, including toilets, buckets of water, and the children have to be adequately protected.